last but not least, we have the labral tear / impingement tests that are going to be most common. Again, labral tears frequently happen with really end range stuff. I've seen it in soccer athletes and in football kickers, but we can also see it in people like linemen or people who are putting a ton of stress in their hips, wrestlers, that kind of stuff. I've seen some in cheerleaders and tumblers because of some of the crazy positions that they get in, like gymnasts. But again, these people are going to complain of things that often aren't just, oh, it's obviously their hip, but they are going to be complaining of things like clicking, popping, locking, similar to what we talked about in some of those deep articular issues. So deep-seated pain, sometimes difficult to locate where it is, popping, locking, clicking. Especially look for those things when we're talking about these labral issues or impingement issues. So the first one is the Fair test and or the Fadir test. Remember, the Fadir test is when they're laying supine just like she is, and the Fair test is basically the exact same test, but they're laying on their opposite side, so sideline on their opposite side. Then we have the flexion internal rotation test, and just to go back to, remember, we're not paying attention to where the ankle lower leg is going, we're looking at where the thigh is going, so we just flex the person and put them into an internally rotated position. And if we feel some kind of pain, or they report, or you feel, well, they would report pain, I wouldn't know that there was pain, but they would report pain, locking, popping, clicking, something that is similar to the mechanisms that they are frequently experiencing when they're participating in sport or doing their ADLs, that would be a positive test, especially if it was different from the opposite side. You can do the same one and then add axial compression, so pushing down again straight through their femur. So you would flex, internally rotate, and then push straight down, so you're applying that compression, and you'd be really stressing the posterior side. And again, you can change the levels of flexion that you have them in a little bit. The last one is a very similar position, but it's the flexion adduction test with compression. So again, same flexion, no rotation, move them into adduction, and then again, we're pushing straight down. You can take your whole arm and wrap around it, and you're applying that axial compression straight through the femur, through the hip. And again, we're really primarily looking at that posterior aspect of the labrum, but if we're talking about impingement, they might be catching the anterior side of the labrum with any of those big flexion tests. All the same signs and symptoms, though, you're going to be looking for. I will tell you this, the labrum can be very finicky, as well as impingement things, so impinging on any of the tendons or nerves going through there. If that is happening and they're reporting the right signs and symptoms and their mechanism is right, or it's been long standing, they're reporting this groin pain, hip pain, low back pain, butt pain, you might maybe need to send them for diagnostic imaging. Ideally, you need to get an MRI with contrast, because the labrum can lay just perfectly together, and so a regular MRI won't necessarily always identify the tears right away, whether it's coming straight off the acetabulum or mid-labrum. And by putting the dye in there, what will happen is the dye will seep through the tears and allow you / the MD to be able to identify these tears far more easily. And it's going to be very helpful to you and the patient. If it's significant enough, they might have to have surgery, but if it's in a location where rest and time can help them, hopefully they won't actually have to go under the scalpel.